Good morning, everyone. I'm Muriel Bowser. I'm the mayor of Washington, D.C. Today, I am providing a situational update on the district's response to COVID-19. I'm joined by members of my administration, as well as Maria Gomez, who's the president and CEO of Mary Center, an outstanding community health provider in Washington, D.C. Of course, in addition to her work at Mary Center, Maria is a nurse, and we want to say Happy Nurses Week to Maria and all of the nurses on the front lines providing outstanding care to D.C. residents. Let me say a little bit about what we are reporting today. 245 new cases in Washington, D.C., as well as additional deaths in the city, bringing our total of lives lost to 304 Washingtonians who have succumbed to this virus. We are also showing the past week in our experience with positive cases, some days up, some days down over the last week. These numbers are indeed sobering. And while we're looking at them, I want to take a few moments to talk about the question that I've been getting all week, and that's when are we going to open in the city? And as we have said all along, our approach to looking at this hasn't changed. We will follow the data and the science, and our priority is the health and safety of D.C. residents, and our choices will certainly reflect that. We will move forward by weighing the risks of adapting. We know, of course, that as we move forward without a vaccine or a treatment for COVID-19, we must always weigh the risks of each of our actions and adapt accordingly. Our team at DC Health is looking at a number of scenarios and making projections about what will happen as we slowly turn on our economy. And at the same time, the Reopen DC Advisory Group is thinking about how we will adapt, how we can modify the way we do things to protect people and lessen the risk of transmission. But I want to be very clear. We know that when our economy reopens in our jurisdiction, this region and around the country, without a vaccine or a cure, we will see increased infections and we will see increases in loss of life. So these are very important decisions that we have to make, and decisions that need to be based in science and not political expediency. And we will do what is best for Washington, D.C. But I also want to be clear about something else. We are in a much better place than we were just 2 months ago in dealing with this virus. Today, we have more PPE, we have more testing, we have more contact tracing, we have more hospital capacity, more social distancing, and more people are wearing face masks on their essential trips. So there is indeed a reason to be hopeful. We have more resources to help us combat the virus, to find it and isolate people who have been exposed to it, and treat people who get infected and need care. When all of these pieces come together, and when residents, of course, continue to do their part, we know that we can get into phased reopenings, and get in front of the virus instead of chasing the virus, and that continues to be our goal. Again, to get there, we need to blunt the spread of the virus. So I know at times it feels like, what else can I do? We're staying home, and we're going to ask you to continue to stay home. But more than that, we're asking people to listen to their symptoms, to get tested, and to isolate when and if they have a positive test. And so we want to talk in some detail about what that means. It means that we need people, if they have a positive test, to separate from other people in their household. We want them to avoid sharing household items. And if you have to be around other people, especially when seeking medical care, we need you to wear a face mask. And we know that some people don't have the ability to isolate in their own home. So we want you to call us so that we can help you work through your options. And you may do that by calling 1-888-349-8323. 1-888-349-8323. We also want to remind everybody as it gets warm and as we've been going at this for weeks and weeks now, we know people want to get out and need to get out. And I just ask you to think about your own safety and that of your neighbors and friends, and plan to be in places where you can separate. And that is not necessarily at a big park. So try to get your exercise and fresh air close to home. And we know a lot of people will want to celebrate Mother's Day, as I do with your mother, and you may not be able to do that. I won't be able to be physically next to my mother either, but you can celebrate in creative and special ways. And one thing you may consider is supporting a local business, many of whom will be offering specials to go and carry out, but just plan ahead. Make sure that the business you're supporting is also planning ahead and is planned for ways for you to social distance when you order your food ahead of time, when you grab and go, when you protect the workers there by wearing a face mask. And you may want to give your neighbors and friends some idea of who's offering great food and great specials by posting pictures on Mother's Day about the great businesses who are staying open to keep a very critical line of food supply available in the district. I want to finish with a reminder about COVID-19 testing. The number you see, 855-363-0333, will connect you to our appointment line where you are able to get free testing. So please call that number. And we also have a number available in English and Spanish at 844-796-2797. And I just wanted to turn to Maria Gomez for a brief statement about how Mary Center has been serving DC residents during this pandemic.
Thank you, Mayor. This is a great opportunity for us to just say on behalf of Mary Center how important it is to actually do certain things. One is to make sure you wash your hands for 20 seconds with soap and water, to make sure that if you use a sanitizer, there are some fake sanitizers that we've seen, so sanitizers that actually have 60% alcohol, and to make sure that you isolate. We know from just the hundreds of patients that are coming in through Mary Center that isolation works, and the isolation is very, very important. 6 feet apart. If for some reason you cannot isolate because you have to work, make sure that you ask your employer that they have masks. They are required to have masks for you, that you request that your coworkers also wear a mask, and that they try to work within 6 feet apart as much as possible. Because even if you don't have the symptoms, we know that people can still be contagious without symptoms. And avoiding the sharing of food, I think, is something that the mayor has said. If you are ordering for restaurants, make sure you order something that is already cooked and not raw food. That's really important. I'd just like to also say that while this is all going on, we also need to make sure that we take care of our health. And so if you call your provider and your provider is asking you to come to see them, particularly I'm talking about pregnant women, children under 2 years of age, and people who have other medical problems such as diabetes. These are issues that really need to be addressed. Pregnancy is short, kids need to be immunized. We don't want to have an epidemic in regards to not being immunized, and then making sure that your health problem, underlying health problems don't get worse. So it is important, I think, that those individuals don't go unchecked, that we have great outcomes during pregnancy, and that we have our children immunized, and that our underlying problems don't get worsened. I'd like to also emphasize something really important, and that is that the city, under the mayor's office, has, and I haven't been asked to do this because I have actually tested ourselves over at Mary Center for the last few weeks, and that is the government has a line where there's essential groceries, essential materials for toothpaste and things, that emergency items and food distribution, that groceries, that is working marvelous. It's just working really, really great. And so there is the number that was put on your screen, 1-888-349-8323. That line is really, really, really working. And it will, especially for people who are positive, this is a great program to keep you isolated, because we know that that's what really works. We have been testing, and I just want to say that we are working with the DC Primary Care Association, Dr. Nesbitt from the DC Health, working to make sure that we really increase the amount of testing in the city, that we deal with the contact tracing. And those are things that I think are going to go a long ways to flatten the curve.
Thank you, Maria.
Thank you.
Thank you. We'll take questions. Sam?
Yes, Mayor. I understand that your stay-at-home order expires a week from today. Do you know at this point whether you're going to let it expire or renew it, or what?
We will definitely brief you out on our plans post May 15th, not today. Yes.
Well, do you know, I mean, we had kind of been expecting it last time. 1 week out, you made the announcement, and you had in the past indicated that today would be the day that you would let the public know about.
I did not indicate that. In fact, I indicated something different, that I thought that we would actually be closer to May 15th before we would be able to announce anything. Yes.
Question for Dr. Nesbitt. Dr. Nesbitt, there's a perception in some communities that if you can't go to the hospital because you're not going to be treated unless you have COVID-19. If you break your leg, have a heart attack, have a stroke, or something like that, don't go to the hospital because you're not going to be treated. Is that true?
That is absolutely not true. And it's a great opportunity. I'm happy that you've asked this question, and it allows me to even build on what Maria was speaking to just a time ago. We want to make sure that everybody knows that our hospitals, our physicians' offices, our health centers are open, and they're open to provide people the health care that they need. Anyone who has a need to see a healthcare provider should absolutely do so. What we have seen since the beginning of the pandemic's impact in the district is that healthcare providers have begun to offer services in a different way. So we have always encouraged people to call ahead before going in for non-emergency. So what does that mean, and what does that look like? If you were scheduled for a doctor's appointment, you should call your doctor to see if you still need to keep that in-person appointment. Depending on what your health condition is, they may recommend to you, we may need to wait a week before you come in person, or this is something that we want to see you in the office in person for because we want to put eyes on you. And we may make a decision that if you were scheduled for surgery, this is a surgery that still needs to happen. It can't be delayed for 1 week, 2 weeks, 2 months. This is something that needs to be taken care of. And that is a decision for your treating clinician to make. The health department has not published a list of conditions that are absolute, that is exhaustive of things that can be delayed indefinitely. That's not the role of the health department. What the health department says is that things that are elective, we know that certain cosmetic procedures are all agreed upon to be elective. However, we don't make blanket statements that everything a plastic surgeon does, for example, is elective. Some plastic surgeons save people's hands for example, from amputation. So we would never say that all plastic surgeons can't work during the pandemic. The other thing that you mentioned is that if someone breaks their leg, they absolutely need treatment. They should absolutely go to the hospital and have treatment. They need to have treatment to fix the leg from being broken. They need to have treatment to eliminate their pain. And our hospitals are still open to provide that care. At no time have hospitals in the District of Columbia, in the National Capital Region, or in the U.S. been made to only provide care to patients who have COVID-19. We've even set up our system so that when we have a medical surge related to COVID-19, we will have the capacity to still deal with those medical emergencies that happen. So that's something we really want people to be able to understand. I've received calls from people who work in the government, from friends of mine. I've received emails that says, I have a doctor's appointment, should I go? If your doctor is telling you to come in for an appointment, you should go. Your doctor knows you the best. They know you better than the doctors at the health department because they have a relationship with you. And they're making a decision as to whether or not that telehealth visit is the appropriate modality, or if you need an in-person visit. What we don't want is pandemics or epidemics of another kind rearing their head after we've addressed and contained COVID-19. We don't want to see the reemergence of vaccine-preventable illnesses because children haven't been immunized. We don't want to see an increase in infant mortality and maternal mortality because moms didn't receive the care they needed to receive when they were pregnant. And we absolutely don't want to see an increase in chronic health conditions or death related to chronic health conditions because individuals weren't receiving that type of care. So yes, healthcare practices, physicians' offices are open for business. They are making assessments of the type of care that patients need. And if patients need to have surgeries that should not be delayed for weeks at a time because they will save people's lives, save people's limbs, save people's organs, they should be having those surgeries and those procedures because it is their clinician who is making the decision that it is necessary.
You got that?
I'm serious about that.
We know. We got it. We got it. Thank you, Doc. Alex from CNN.
Hi, Mayor Bowser. Thanks so much for taking my question. The Office of Personnel Management, OPM, last night put out new guidance for federal agencies saying that they will begin a phased transition to normal operations, and agencies will make operating decisions based on state or locality of the agency. So I'm wondering, what guidance have you gotten from the federal government in terms of these offices opening back up? What's your understanding of how federal workers are going to be going back to work? And what's your reaction of them going back to work if the city isn't open?
That didn't sound like the first part of your question. I actually
Sorry about
haven't.
that.
I haven't seen what they sent out, so let me take a look at it, and we'll get back to you.
But if indeed the federal government via OPM is telling their workers to start going back to work in a phased way, do you think the city is ready for federal workers to go back to office buildings?
Did you say at the start of your question, can you start all from the beginning?
Yes. I don't know if you can hear me better now. The office, so OPM on their website last night issued new guidance saying that the federal government will begin a phased transition to normal operation. And our understanding is that a number of federal agencies and departments are going to be bringing their workers back to their respective buildings in different ways, in phased ways. And I'm wondering what your understanding of that is, and whether you've gotten any guidance from the government, considering you are running this city, and what your reaction is to these federal workers going back to their buildings if the city itself is not open.
Okay, I thought when you, in your first lead up, you mentioned that the guidance said that it was in accordance with the jurisdictions and localities. You didn't mention that the second time.
Yes, there's a line that says agencies will make operating decisions based on state or locality of duty stations.
Okay, so we will review that, and it sounds like what they're saying is their phases have to be in line with the state or locality. So I don't hear a conflict at this stage, but I want to look at it in a little bit more detail.
But have you had any contact with OPM about their phased reopening?
I think the last time we talked, I told you that our HR director is regularly talking to OPM. Okay, Sophie from the Washington
And
Times.
do you think the city is ready for these federal workers to go back?
I will refer you to my letter to OPM indicating that we want a telework posture where the majority of workers can stay on telework as long as possible. We recognize, however, just like with DC government, that there are workers who will need to report to their workstations. And we think that the proportion of workers, the larger proportion of workers being on telework is best for everybody. Yes, Sophie from the Washington Times.
Hi, good morning. My first question is for Dr. Nesbitt. We're still seeing hundreds of cases being confirmed every day, and I was wondering if you can give us an idea of where those cases are being transmitted, whether it's in workplace settings or congregate settings or household settings, or could you give us a breakdown?
Let me repeat the question. The question was, we're still seeing hundreds of cases reported every day, and can Dr. Nesbitt tell us where those cases are being transmitted?
So, as you know, this week we started publishing more data in terms of where cases are geographically by neighborhood. We are not yet at the point where we're able to say the majority of our cases are happening only in congregate settings. So we still have a level of widespread community transmission where cases are happening in households, cases are happening in congregate settings, et cetera. So that's the extent of the conclusions we're able to draw. As you will recall earlier this week, and the points that we are reiterating today, which encourage people to isolate, we have concern that we have more transmission that is happening in households because individuals may not be isolating properly within households. And we want people who are not able to do that to be able to reach out to us for assistance by calling 1-888-349-8323.
Bennett from the Washington
Hi.
Post.
Hi, thanks for taking my call. I have 3 questions. First, to piggyback off of what Dr. Nesbitt was saying. So when people who are not able to isolate at home call that hotline, what kind of assistance is the city offering? And because you mentioned a few times this week that household transmissions are a concern, is the city taking steps to open up hotels or convention center or other spaces to people who need to isolate from their household members?
We have, Bennett, from the beginning, identified hotels for quarantine, and we continue to make available quarantine hotel space for DC residents. And so when you get that call, more than likely that you will be, we will work with you on your housing and your food and supply needs.
And you mentioned that you've had this available from the beginning, but these household transmissions have been an issue in recent weeks, according to what we've been hearing. So is the city changing up its approach to reduce the number of household transmissions?
Well, we're certainly calling more attention to it and making sure people know what resources are available. We're also emphasizing to people how they can isolate in their home if they're able, and reminding people of those strategies within their own home, reminding them that they can have supplies delivered upon request. And in the case that they can't isolate, also talking to them about additional housing resources.
And in your presentation, what did you mean when you said the city needs to weigh the risks and adapt going forward? Specifically with adapting, can you elaborate on that?
Sure. What we mean by adapt is to look at, as we are doing, the advisory committee is doing with its 11 sector committees, looking at how different businesses, but also different services can be offered. How are we going to be able to adapt school, for example? How will we adapt how restaurants can operate? How will we adapt how we use our public space? All of those things mean that we recognize that opening up is going to allow for more spread of infection. And without a cure or a vaccine, we have to do everything that we can with how we operate to mitigate the spread of the virus. Yes.
So when you first gave your projections for the number of fatalities were between 200 and 1,000. Today you opened up saying that we're in a better place today than we were 2 months ago, and then you indicated in the past that things seem to be working as far as flattening the curve. Do you have an update on those numbers, what your projections are now, as far as what the district will see, as far as a total death total?
We don't. And Mark, a lot of it will, a lot of things are depending on how we, and that this includes our case counts and lives lost in the district. It's how we are able to open up safely. A lot of the models that you saw early on were focused on strict social distancing. And you're seeing updates to a lot of models now that account for social distancing that is, how can I say, less strictly adhered to, which we're going to see regardless of any change. People are, it's hard to social distance for 7 straight weeks, 8 straight weeks, all of those things. So we see some loosening of that, but we will also see different parts of our economy slowly turn on. And so that changes, obviously, the number of cases and likely the number of people who will succumb to the disease.
Do you think it would be higher than 1,000 now?
No, I didn't say that.
Okay, I just was asking for clarification.
Right. I don't have a number to report to you. Yes. Yes.
The federal government has indicated that they're at least considering the possibility of, again, extending the personal income tax deadline past July. And I'm just wondering if you had given any thought to that for DC income tax, extending that deadline once again.
I hadn't heard that, Mark. If they do, we like to be in line with the federal government, but that's a discussion I would want to have in a little bit more detail with my team. We do know, somebody asked me, one of the last conversations, was I concerned about the IRS coming to work and reporting to their offices. The IRS is working, they're processing taxes from last year, and they're issuing refunds. So it's a good thing for people who are owed money from the IRS to get that money. So if you don't file, then you won't get it. Yes.
I got a note from a homeless man named Eric Sheptok who was quarantined, and he was saying, I guess his complaint is that once you're inside the hotel, he says the homeless can't get anything from anyone or give anything to anyone outside the hotel. He's concerned because he says they used to have deliveries were possible. People have been allowed to order additional food, but now they're unable to get anything that is not freely given by DHS. Does it discourage people from going into quarantine if they realize they're going to be sort of really shut off and can't do any kind of exchange?
I don't know what exchange you're talking about, and I don't want to talk about an individual circumstance, Sam. I will ask Director Geldhart to talk to you about quarantine.
So, again, I don't know the individual circumstance, Sam. I don't want to get into the individual circumstance for each person there, but the needs for the folks that are in the isolation and quarantine have been very, very much thought through on what are going to be the needs for folks. And the whole point behind isolation and quarantine is to be isolated and quarantined during the time when the person could spread the virus. So the intent of not having visitors come in to visit people there not having a lot of contact with folks outside of that area is what we're asking everybody to do. So as folks do convalesce in the hotels that we have, we provide for meals throughout the day, snacks as well. We provide for the things that they need for personal hygiene within there, and the ability to talk to medical personnel if they need additional medicines or things that they need while they're in isolation and quarantine. So we provide the opportunity for folks with the staff that are in the isolation and quarantine, for those folks that need things, to ask for them and then get them brought to them.
I see, but my understanding from him is that you can't even drop anything off to be given to a person like that. There's basically, he's saying no contact. But is that the case, or do you know?
So this is what we're trying to do, is to limit the contact with folks that need to be isolated and quarantined.
Also, Mayor, today we saw the national unemployment figures. Obviously, I think 14.7%. I'm just curious about your thoughts here in the city as you, I guess, think about going back to normal at some point.
It is obviously we're concerned about the national economy. Those numbers at 14%, I think we hear some economists thinking we could easily get to 20% unemployment. Those are depression level numbers, so that's obviously a concern. We do know a lot of people will be hired back. I think we're almost at 90,000 people who have applied for DC unemployment. That's 90,000 workers out of usually just over 1 million workers in the district. So those are big numbers. If we believe the forecast, we know that we can be on at least a 2-year recovery path to getting people back to work. So we have a very serious health pandemic to respond to, but we also have a very serious economic recovery path to follow aggressively to bring the city back.
How is it going to be to exist if you say have Maryland, which is a few miles that way, and Virginia a few miles that way, open, and we're not? How does that work? I mean, how difficult is that to maintain? I guess if restaurants are open, you just drive, 5 miles, and you're in a restaurant where you can eat.
Well, Sam, I can only respond to you in the way that I've already responded to you, that we have to make decisions that are right for the district. You see our numbers, that we haven't seen a sustained plateau, and certainly not a decrease in our numbers. Today, we reported one of the highest numbers of deaths in the district. And I can't in good conscience, nor has my medical staff recommended to me that we open restaurants while we have increasing numbers of people dying. It makes no sense. Yes. Steve from the Washington Post.
Hi, this question is for Dr. Nesbitt. I asked a couple of weeks ago, and you gave me a good answer, that 3,700, you had sort of a theoretical lab capacity among the publicly directed labs of 3,700 people a day based on equipment, but capacity was limited to about 1,500 a day based on the availability of reagents. So I've got two questions. The first is, are those numbers, could you update those numbers if they have changed? And two, I know the average number of tests per day remain about 800. Could you give me sort of why you're sort of not testing at full capacity, whether we're talking about 1,500 or 3,700 or another number?
So I would ask you to go back and look at the number of tests per day, because that number has been increasing. Maria has spoken to that as well. When you look at the average number of tests per day, you should account for some healthcare practices are not open on Saturdays and Sundays, so you see smaller numbers on those days. But we have had over the past week quite a few days where we've had over 1,000 people tested in a given day. So I'd ask you to re-examine that. In terms of the testing capacity per day, in terms of the instruments and reagents, We have not seen a change there. We did have some very promising conversations with the federal government in terms of support for increasing testing capacity in states in the months of May and June, and conversations that they were having with manufacturers of these instruments and who produce the reagents to increase the supply. Unfortunately, those conversations where the federal government made progress are not the manufacturers of the instruments that are here in the district. And so there has not been an increase in the supply of reagents to date to be able to increase that testing capacity from 1,500 a day closer to that 3,700 a day that sits here in our city. We are continue to sit with some level of cautious optimism as states continue to make requests of those manufacturers to produce more reagents that we may be able to get closer to that 3,700 per day. But we are seeing more practices come online in terms of offering more testing and understanding the role that they play in shifting capacity into our healthcare infrastructure in lieu of all of the testing capacity being in mass testing sites.
That's a very clear answer, and I appreciate it. Are you able to say what manufacturer? Is it one manufacturer that DC's equipment is on, or several that has the limitation of reagents?
There are several several manufacturers that make the instruments in the district. I can recall off the top of my head that the manufacturer that the federal government made the most progress with in producing more reagents was Thermo Fisher, and we don't have many of those testing platforms in the district. Mark?
Could you update us on the antibody testing, when that might be available for DC residents?
Sure. So the Department of Forensic Services is doing the test verification or validation this week in hopes to have the serology testing available as early as possibly Monday. We've been in touch with a number of health centers and hospitals in terms of offering the test. We have established what we call the protocol for who should be offered the test based on where the test has the greatest amount of accuracy. It is a IgG antibody test, and IgG antibodies tend to be at the greatest presence in our body about 14 days if you've been exposed or have infection, whether you have symptoms or not, about 14 days out. So for anyone who thinks they've had even mild symptoms, then they should not be given that test. They should be given the current test that we have available, the nasal swab. But we've given some clear guidance to people who want to offer the testing. We're working with all of our health centers, the DC Primary Care Association member health centers, to identify how they can offer the testing. It is a blood draw, so we've been in contact with them over the past several days to figure out what they need in terms of being clinical partners for us, as well as the hospitals, and the test should be more widely available in the coming days to week.
You mentioned, I appreciate that update. You mentioned that you've developed a protocol. Who would, I guess, qualify or priority? So, who would that be?
Yeah, so again, any member of the general public would be eligible to be tested, but we know that there are certain groups who have a higher risk of exposure, and we want to be sure to have those folks be tested so we can understand what prevalence in our community really looks like. So those would be healthcare workers, first responders, individuals who are in congregate settings such as our long-term care facilities, intermediate care facilities, detention centers, and group homes. They're more likely to have been exposed, so we definitely want to have those types of sites or those types of individuals participating. As you know, there's a lot of interest in terms of what is happening in the pediatric population. Do they actually get the infection of SARS-CoV-2 and don't have symptoms? or do they not get infected at all? So we really want to make sure we have a strong partnership with pediatric care providers so that many of them will get tested with antibody testing, and that will give not only us in the district, but us in the U.S. a good idea of what infection in that population looks like. So we want to be really focused on them. But
Quick question. Do you know how many tests you will have available, and then what is the turnaround time on this
we're
test?
ordering 10,000 at the public health lab, and we're hoping the manufacturer can accommodate us. There are other clinical laboratories in the city who are planning to use the exact same assay or test that we're ordering. So that will increase the number of tests that are available in the city beyond just what will be done through the public health lab. And a day.
Thank you.
Mm-hmm. Pardon?
Where will it be available?
We're identifying all of the clinical sites right now where people can go to get tested. So we should have that finalized soon.
Okay, is there a last question? That's it? Okay, thank you, everybody.